I'm Dr. Moka Lantum. I'm the CEO of Checkups. The problem that our organization is solving is that if you don't have money and you have a medical need, what are your options? And the current state is that many people resort to borrow from informal sources, families and friends, or their employer. And in that process, they either get very predatory terms or it delays care. We envision a world whereby everybody can have quick access to a microcredit based on their credit history with their financial institution that unlocks a certain amount of money based on how much they can. But then here's the magic. That money unlocked gives 4 times more value than market rate insurance or cash payment for the same service. And to consume those benefits, you just need to send a text message by WhatsApp. You get access to the doctor, you can access medication, you can access labs, and you can access diagnosis. Okay. But we're in Africa. People care for their families. They care for their employees. They care for their friends. Our model allows you to share the benefits African style, which is something that traditional insurance does not allow. So we are enabling families and small businesses access microcredits and care at 4x market value, which they can share with their loved ones through WhatsApp. So we do what we call health benefits trading, right? Now, so if let's say you have money on your WhatsApp, let's say 10,000 shillings, you go to our website or you text COVA, C-O-V-A, to our number 0111 050 290. You'd get a menu which says enroll. You put in your information and then you pay the 10,000. You select the package that works for you. So you want the package that has consultation, labs, diagnostics, medication, and specialists, you select deluxe. Or if you don't want the specialist, you select smart. Or if you don't want medication, you can go with the smart care. Or if you want only medication, you go medication only. And each one has its algorithm that unlocks a certain amount of benefits. You'd get a message saying this is the number of benefits you have unlocked. On average, 4x. When you are sick, all you then now need to do is text again, cover, you get the menu. I want to talk to the doctor. Your benefits get deducted. So for every consultation, benefits are deducted. For every lab test, benefits are deducted. Then if you exhaust your benefits, you top up, right? And everyone in your pool can share in those benefits in real time, again via WhatsApp. The founding story goes back to a baby who was in Ahero, in actually Kasongo is the name of the village. It's in Western Kenya. At the time, we're doing electronic medical records, right? This was a baby that came with the mother and the father. The baby was a 6-month-old baby, and the father was holding the baby. Now, if you've done emergency care as I've done, you know that when the father is carrying the baby, the symbolism of that is the mother can't run fast enough to emergency. So you kind of get a sense of there's something urgent. So I'm paying attention to the software and talking to the staff, and I glimpse and I see what's happening. I ask the nurse what's going on. She says, well, she thinks the baby has malaria. I said, well, parents don't rush for malaria. If it's malaria, it's the mother who comes alone with a bottle of milk. This one, the parents were serious. So I take a look at the baby and I see the baby has pneumonia. I diagnose the baby with pneumonia at 8:30 in the morning and prescribe Rocephin, IV Rocephin. There's nothing, you need IV drugs to go into the lungs to kill the bacteria. The facility did not have Rocephin. They now say, go 15 minutes down to a clinic called Ombei Clinic. That is now a border ride for 2 persons and the baby. Transport, 300 shillings. They get there, no Rocephin. They ask them to leave from that Ombei Clinic to Ahero District Hospital. 45 minutes in a taxi, 500 shillings. They get there, no medicine. Then by now it is 10 o'clock. Then they leave now, they wait for a taxi to take them to Kisumu General. By the time they get to Kisumu General, it's 4 o'clock in the afternoon. They say, okay, we have seen the baby. They said some doctor said the baby has pneumonia. And they said, yes, he has pneumonia. We need Rocephin. How much is Rocephin? 4,000 shillings for the first dose. The parents say, we don't have. So the dad leaves the mother. They comes back all the way to Ahero, goes to the village, looks for money, and then goes back again. Treatment starts at midnight. Fortunately, that baby, Clifford, survived after 10 days of admission. When you look at that scenario, you ask yourself, what failed? Obviously, we can easily say there was no inventory, but really, that person could have had information on inventory, the cost of the medication, and where to go to save time, right? They saved, because of the inefficiencies, they lost a lot of money. They had to borrow money from the village at a higher price, right? And so that scenario said we could do a lot. There's logistics we need to think about. There is lending we need to think about. And then there's inventory management you needed to think about. So as we're building Checkups Cover, we want to make sure that we have partnerships with financial institutions that can lend at multiple levels. So that family could have taken a 4,000 loan, pay that over 3 weeks. That baby could have had treatment start by 10 o'clock. If a WhatsApp message we could have sent for dispatch of the medication to that local dispensary, and they could have given that baby the medicine without incurring the transportation. And it would have made that family a lot less poorer because we're able to create a solution. So Clifford is the reason why we now have cover. And we celebrate them every day because it is that story that said we have to think about healthcare and access to care in a very fundamental way. But then fast forward, we might think it is a rural problem. We started looking in Nairobi. 7 out of 10 patients that we prescribed had to say, I'll come back tomorrow. Give me 2 days, or I'll come back at end month. That shows that it is not a matter of knowing the hospital to go to. It's a matter of how fast can I unlock credit. And if you are employed and you don't have insurance, the carrier will say banked and insured. You have to wait for payday before you access care. So payday and healthcare are in conflict. And if we can bridge that gap using cover, then I think we have made a contribution to access to healthcare and engaging financial partners like banks who are now missing from that equation and bringing them into the ecosystem. You're putting your money in the bank, they can help you in the time of need. And for us, that's where the magic happens. I would start by contrasting it with what people are used to. People are used to paying cash or going with insurance. The problem with cash is that you need to have it. And if you don't have it, you're stuck. With insurance, it's great, but there are lots of restrictions. You have a waiting period. So if you buy insurance today, you can't use it today. Most likely you have to wait for 6 to 9 months, right? There are restrictions on who you can have. It's a nuclear family, father, mother, children. Any other relationship, disregarded. Age limit over 65 out. So parents are excluded. Pre-existing conditions, increased premiums, or excluded. So you see that framework which we are looking at is designed to exclude. That's why it's not more than 5% penetration in the market. And it depends on now only an employer. So you must be formally employed to access insurance in most cases. That excludes the informal market, farmers, market traders, small business owners, small law firms, small tax accounting firms. All of them are excluded from that conversation, right? Because most insurances are not really excited if you do not have at least 30 employees, because at that point you're a high risk group for them, right? Based on the actuarial model, right? So there's just that current state that is so raw. And what we are saying is that, no, you come to a platform, you trade benefits. So we have created the model whereby you can now access healthcare at a much lower price by prepaying and trading benefits. The benefits you keep, they don't expire. So that's the first thing. You get 4x more value. You access care via WhatsApp because we are not controlling your utilization. We are increasing your access and we're delivering medicines to you. On the insurance model, that's a risky model because then now you make 90% of people consume the product, right? So you have to put barriers to utilization in insurance. With cover, we open the barriers, right? And that's the difference between cover and the current way of purchasing healthcare. The last one is introducing the bank financing, right? Because in insurance and cash, you have the money, you go ahead. If you don't have it, you're stuck, right? But most people, 75% of households have a line of credit, some credit history with a bank that they could leverage in case of a healthcare need. Build a company, right? As any other venture that has the potential to scale, you must be able to identify the problem. right? So in the venture building process, the first assumption was that it was an access issue. So let's build a network of clinics. We built a network of clinics. We had 8. We had to shut 6 down, right? Because it was not proximity to the customer. That's stuff. It is, you can be close to me, I don't have money. What happens, right? I'll just become a dysfunctional clinic, right? So we made those errors, systematic, not necessary errors, are thinking of where is the problem. So we said it's a problem issue. Then we say, no, it's an affordability issue. You discount, but then you discount so much that your product, you cannot cover your overhead, right? So we peeled down the onion, and it took us 3 years to realize that no, the issue is 7 out of 10 don't have cash at the time of visit. Just like Clifford's parents, right? So it's not the lack of awareness about your hypertension, your diabetes, is I just don't have cash, so I can't engage, right? So if we do not address that issue, then we are limited. And that's when we started saying, now I think we've really zeroed in on the issue, right? So now let's start back engineering. And so now we had to optimize our supply chain. So how do you optimize the supply chain to fit that financing model, right? That is one area. How do you build a team? What kind of leadership team do you need to have to address that problem? You need people with banking law experience. You need people with communication experience. You need people with who can build network of providers. You need supply chain experts. You need IT engineers. So we've had to take a while to build a team. And then there's the technology frontier, right? So we started initially was an EMR. Then we said, okay, let us have an app for patients. We killed that app. It was too expensive to operate. And now we're in a place where we're saying, no, let us build in WhatsApp because WhatsApp is accessible to everybody, right? And then now we're going into the new frontier of AI. How do we leverage AI to make the customer experience even 10 times better, right? So because there's still a lot of friction. If you do web-based services, there's a lot of friction. If you have to click buttons in WhatsApp or USSD, how can we enhance the user journey using AI, right? So we're able to assess the intent of the customer and increase the speed at which they are buying. Good case scenario, right now, if you come to the website, you're like, okay, how much benefit should I buy? Should it be 10,000, 20,000, 30,000? With the next version that we're working on, it will ask you a set of questions. How big is your family? How many people you want to stuff? What are the issues? Okay, we recommend this because this is how it works out for you. So you go, you trade, and you buy the benefit because now we understand your intent because of some of the AI engines that we are building, right? And those are some of the things that when we went to the tech week, we realized that we really, really have a big opportunity now to make the service even more accessible to people because we can understand their intent when they come to our website or when they engage us on first touch. I'll describe the experience as walking into a room with your eyes closed. Then you open, then the lights are in your eyes. You see the world from a whole new perspective. Not that we are in the dark ages. We are not. We are enlightened, as you can see from what we are doing. But the rate at which technology is developing is a rate even governments cannot control or imagine. One of the companies that we interacted with, they are building software in AI. And they are what's called agentic software solutions. Where now as a business, I would have my AI agent on the platform. You, Laura, have your AI agent. All I need to tell my agent, book an appointment with Laura and tell her about the interview and give her my pitch deck and give her the information. It will shake hands with your agent and all that transaction is done in 2 seconds. If I want to book a ticket, I just say, I need to travel to London tomorrow. Get me the cheapest hotel, the easiest flight, 5 days, I need to be back, stuff. It would go execute, shake hands with the cheapest airline out there, control, make the payment and stuff. They are using a combination of AI, blockchain, and crypto off-ramping and on-ramping to complete transactions in 2 seconds without any human intervention. Understanding the intent of the user. Think about the level of disruption. That means even governments cannot track tax. That means even Visa and MasterCard, which charge 2% per transaction now, will not even have visibility of that transaction. Airline companies would be trading. Somebody can trade tickets in 1 day. They don't need brokers and travel agents to make those things happen. Think about the level of disruption that awaits us. So how do you anticipate that? how do you position your company for that kind of growth? So when I said I walked into the room and my eyes opened, it was a 360 spin of the head, thanks to the 360 startup networking that was part of, initiated by the Kala team. So it was something that I would say was transformational, and I feel very fortunate to be amongst the few who had the opportunity to experience London Tech 2025, because 2026, it will be people reporting how much disruption has happened, as opposed to those of us seeing it before it unfolds. What excites me is a very exciting future, I must say, right? Because with the new technology, we can fast track the development of software that integrates with banks. One thing that's uncharacteristic about the banking sector, they are working on very old software platforms, most banks. Some are on Cobalt, right? I was talking to the chief technology officer for Capital One Bank in the US, the third largest bank, or one of the top three, and their whole back end is based on Cobalt. You can't hire a Cobalt developer in this day and age. So if we do not have an agile software platform that can integrate with banks, then the ability to scale becomes very constrained. So really, I'm very excited because we now have to develop a technology strategy where the speed at which we integrate with banks and financial service partners, pension funds, microfinance organizations has to be done at scale, because that's where people are borrowing from, right? That's where the money is, and we have to bring that. So that's the one thing that we're excited about. The second thing that I would say is a daunting task. At the end of the day, we need to be able to attract venture capital, private equity, or grants at scale. It's a very competitive market, and it's even getting more competitive because the companies that are now exiting are exiting at 2,000x return on the initial investment. In Africa, they're asking us to come with 50x. What does that mean materially? That means if you give me $50,000 as an equity, I have to give you back $1 million within 5 years. So think about that level of scale we need to be able to drive. And that means we have to look at cross-border solutions very quickly. Kenya is not an addressable market. Africa is not. We have to look at solutions that can scale to Europe and the US to attract venture capital or PE money. So that means that for us, the opportunity to engage the diaspora market is a very key opportunity. That's why also working with Jasiri Group in London was a very key opportunity, because they now understand the London diaspora ecosystem. And certainly we need to look at diaspora market as a potential, because that addressable market of people outside who are sending money, remittances to the African market, becomes now a very strong business case to be able to unlock VC money, right? So we have a work cut out to make this work. So I'm not sleeping, and that's why I said I went to bed at 9 a.m. and I couldn't be at 10 a.m. just because the clock did not allow. Yeah. Your money matters when you're spending in healthcare. Think twice about it. Don't spend it carelessly. Use it wisely. Right now, just text cover or hi to our number, and you'll be amazed how much you can save with every transaction. Even if you're paying cash, you'd save, but you'd even save more if you're using cover, because you're not only saving for yourself, you're now helping your community become a much more savvy spender on every healthcare dollar. So that is really what we want to be known for. That is our opportunity to change the way healthcare is financed in Africa. We need to rewrite how systems work for the African market. Insurance is not a model for the African market as far as healthcare is concerned. We need to rethink healthcare financing, and that is our bold vision.